Now that we've talked about short-term memory, working memory, and long-term memory, we're going to be talking a bit about recall and some disorders of memory. So first, when we talk about retrieval, we oftentimes use different cues in order to remember the information or to retrieve it, to recall it. So that can be any stimulus that helps you access that information. This could be recognition or recall. We're talking about recognition a little bit, but we're first going to be talking about things regarding recall. We have what's called the encoding specificity effect. That's when important bits of information were stored at the same time as the important information that we're trying to remember. This could be the context or state that we learn this information, and this is called state or context dependent learning. So for an example, the context in which we learn something is really important. So we're better at recalling information when we're tested in the same environment as where we learned it. So for an example, if you learn the information in this classroom, it's best to take your test in this classroom because you're able to recall that information better. There's actually a study that they had subjects learning a list of words underwater, and when they're tested later on, they actually recall that list better when they were underwater again than when they were tested on the surface in a classroom. So the context in which you learn information also gets stored along with it, so staying in that same context can be really, really useful. Same thing can happen with state-dependent retrieval. So your mental state is also part of your context. So for your mood, if you're happy when you learn something, you're going to remember it better when you're happy later on. Same thing with being in a depressed or negative mental state. So for an example, if you experience trauma like a bad car accident, you're going to remember previous traumas better because you're back into that negative mental state. State-dependent retrieval can also be your physical state. So if you're under the influence of alcohol or another substance, this could be medication, drugs, nicotine for an example, if you learn information while in that state, you're going to learn it better when you're again under that state. So if someone learned material while they're drinking, they're going to remember it better when they're drinking again than when they're sober, which is why they might remember where they left their car keys last time once they're drinking again. But don't study while you're drinking unless you expect to be drinking during the exam. Don't do this, especially on the college campus. Very bad idea. This also leads to what we call our tip of the tongue state. You ever had that feeling when a memory is available, but it's not quite ready for retrieval? So this is a two-part problem. This could be availability. This is when memories currently stored in memory are available, so you can actually get to them. And then accessibility is when memories currently stored in memory can both be retrieved when necessary and are both available and accessible. So when we get that feeling of knowing. So if I ask you, what's the capital of the state of Wisconsin? You're probably like, oh, I know that. I maybe remember what it starts with. And so maybe you remember it starts with an M. And now you're thinking of Midwestern cities that actually start with an M sound. Just to relieve all of you, it's Madison. It's not Milwaukee or Minneapolis. So 90% of languages have a phrase for the tip of the tongue state. So some of them will say, it fills my mouth, or it's coating my tongue. So tip of the tongue is what we use in English. It happens more frequently in older adults. They have some problems with the availability and accessibility features when it comes to memory, especially when it comes to just from straight retrieval. But sound-based retrieval can help. So if you think of words that sound with a familiar sound with the same letter, you have a higher likelihood of actually recalling that word. Now, when it comes to recognizing information, it's a little bit easier. So recognition is the ability to correctly identify previously learned information, like a multiple choice test. So you're given all the possible answers and you're just selecting one of them. So sometimes we can recognize a face, but we can't recall the person's name. But the number of distractors can decrease our recognition. So if all the answers in a multiple choice test are very similar, you can select the false positive. So something that seems like the right answer, but it's not quite. Same thing can happen in police lineups. So if you have like all 5 or 6 people standing there, you know that it's one of these people, and you're likely to be distracted by the number of people. If you've ever taken a test where it was like true or false, you have a 50-50 chance of getting it right. If it's 4, it's a 25% chance just on random guesses. But if you can imagine where you have a test where it's you have like 5 or 6 or 7 possible answers, all of the above, none of the above, A and B, B and C, like those crazy tests, those are really difficult to pass because you have a lot more distractors, and that can make it harder for you to recognize the correct answer. Retrieval can also be stored in what we call a flashbulb memory. So some memories seem to be permanently etched into our brains, but scientists are always trying to ask how accurate they are. So, where were you when you heard about the Parkland Marjorie Stoneman Douglas shooting? Perhaps you were in school, maybe someone in your family told you, maybe a friend told you, maybe you saw it on social media. For people in my generation, 9/11 was our big event. There seems to be one of these in almost every generation, and they may change also depending on where you are. So, when these special events or circumstances, such as a national emergency or a personal accident or death, so if you find about the death of a grandparent or a parent, you can form what seems like a perfect and highly durable memory for the event. But research shows that while we feel our flashbulb memories are very accurate, they're not any more accurate than our normal memories are. But they are intensely emotional, which gives them this flashbulb-like quality. It's like a big flash going off, like grabbing that moment and holding on to it. But memories for natural events, such as 9/11, can vary depending on where you are and your connection to the events. So, for 9/11, if you lived in New York, if you worked in aviation, if you had previously visited the trade centers, you're more likely to have a more emotional attachment to that area, and you're more likely to have remembered it. I'm sure for you guys, a lot of you guys live in the Parkland area, or you had friends who were there, or you knew someone who was affected, and that's going to create that flashbulb memory versus, the San Antonio, Texas shooting that happened a few weeks later. Like, do you remember where you were when you heard about that? Probably not, because you're not local to that. So if it's something that has a deep personal connection, you're probably going to create that flashbulb memory. It's a great quote from the late Oliver Sacks. And if you haven't read anything from Oliver Sacks, I highly recommend it. He was a clinical psychologist, and his writing is excellent as far as like learning how to read for like state mandated tests and SAT type reading. It's complex without being too crazy. So I recommend reading his books. I have a couple on the shelf if you want to borrow them. But he wrote in his book, The River of Consciousness, "There is no way by which the events of the world can be directly transmitted or recorded in our brains. Our only truth is narrative truth, the stories we tell each other and ourselves, the stories we continually recategorize and refine." So this goes into our discussion about forgetting. So if you've ever walked out of a supermarket and you've forgotten where you parked the car, or you've forgotten where you left your iPad or your phone, we've talked a lot about how memories are stored, but oftentimes memories are forgotten. Now, I'm sorry this is a blurry graph, but this is the best one I could find. We have what's called the forgetting curve. So when memories are, when you learn something, you feel like it's stored there and it's stuck and it's not going anywhere. But actually, memories begin to decline almost immediately. So from day 0 to day 1, over 50% of what you've learned is now gone. But if you go to a week, you're at 20%. But if you go past 6 months, whatever memory you do hold on to for that event is likely to stay with you for the rest of your life. So imagine I find you in 6 months or a year from now, and I ask you, what do you remember from psychology? Whatever you do remember at that point is likely going to be there for the rest of your life. But if you learn something just once today, and I ask you about it in a week for the test, and you haven't tried to rehearse it or go back and study it, you're probably going to be at about 20% recall. So most of the information that we learn gets forgotten pretty much immediately within that first 24 hours. But then it slows down, and what we hold on to gets held on to for the rest of our lives. This is research actually done by some professors at FIU, so it's a nice local connection for us. Now, people oftentimes think forgetting is a really negative thing, but forgetting is actually an important feature of how we go about the world. If you remembered every single thing that you encountered, your brain would be overwhelmed. And I'm going to show you a video of actually a woman who has what we call superior autobiographical memory. So she doesn't forget any events that have happened in her life. But we're going to get to that in a couple of slides. So some theories about why we forget and how we forget are on this chart here. So we have first the decay theory. This says that there's a gradual fading of memory traces as a function of time. So anything that you learned in school will gradually fade out of your memory over time, especially if you're not using that information. We also have interference theory. This is a disruption of memory is caused by interference of previously learned material or newly learned material. So after you sit through your biology lecture, you forget what you learned in your class before that. So you forget what you learned in history because now you have new information and it's confusing to you now, and you've kind of laid over on top of that information. We also have retrieval theory. This is failure to access material stored in memory is because of a lack or is because of encoding failure or a lack of retrieval cues. So you have difficulty remembering something you know is stored in memory. You know it's there, you just can't bring it out. It's kind of that tip of the tongue state without that feeling of knowing. And then we also have motivated forgetting. This is repression of anxiety provoking material. And you just cannot remember a traumatic childhood experience. You've essentially repressed it. You've pushed it out of your mind. And that's actually a defense mechanism that we'll talk about in a later chapter when we talk about Freud. So each of these theories is probably right in different circumstances. We do know that interference can cause disruption. Decay theory seems to have some biological backing to it. Retrieval theory as well. These are all valid theories. It just kind of depends on the type of information and what we're utilizing it for. So if you look at this graph here, I want you to tell me which one is the correct penny without looking at a penny. So go through and try to figure out which one is the accurate penny. So you're probably struggling with this. Think about how many times you've seen a penny, you've looked at a penny. Maybe as a kid you collected pennies. Pennies are something that we see all the time in our environment, but now when you look at all of these, because they're quite similar, you can't remember which one's correct. And this is due to encoding failure. Encoding failure is the failure to store sufficient information to form a useful memory. We can't code every detail of our world. We would just be overwhelmed. We also do multitasking, so our brains aren't always really focused on what we're viewing. We've talked about change blindness several times now. And so we just don't record things that aren't really that important to us. With the penny, you probably maybe remembered that Lincoln faces to the right-hand side. You're pretty sure it says United States of America on top. It's got the date on there somewhere. But how those are all perfectly laid out, you can't remember. So you can go find a penny and check this for yourself. Disuse is also the theory that memory traces just weaken when memories are not periodically used or retrieved. This is that decay theory. If you're not thinking about something and you're never rehearsing or recalling that information, your brain just might say, okay, we're not going to need this anymore. And we'll use kind of take that connection and use those molecules somewhere else. We talk about interference. This is something that we see quite frequently. So let's say you have some target information that you're trying to learn, but then you learn something before that and now you can't remember that target information. So for me, it could be your address or a new phone number. So let's say you're trying to remember your new phone number, but all you can remember is the phone number that you had before. For whatever reason, you just can't get into your current phone number. Like you can't access that memory. It's what we call proactive interference. This is because the information is kind of moving forward in time. Old information covering up new information. But it also can happen where you have your target information and then information that you learned later has now gone backwards. So let's say your native language is Spanish, you've now learned English, but you can't remember the word for whatever item in Spanish anymore. This is retroactive interference. This information is kind of pushing backwards and covering up previous information. And I kind of give this slide here, this proactive and retroactive interference, because when we talk about amnesia, which is next, these terms are very similar. So when we talk about amnesia, we can have what's called retrograde amnesia. This is a loss of memory for events that preceded a head injury or other amnesia-causing events. So this is a person who, you've probably seen this on TV, they fall off a horse or they hit their head, they're in a car accident, and they wake up and they can't remember who they are, they don't know their spouses, their parents, and they're completely lost. They don't remember how they got there. Anterograde amnesia is memory loss for things that are going to come after that trauma or injury. This is what can happen when someone has a brain surgery and they can't form any new memories. We talked at the very beginning of this chapter about patient HM, who had his hippocampus removed to stop epileptic seizures, and he could not form any new memories. There's another man who has a similar thing. He had a similar procedure done. His name is Clive Wearing. I want you to check out the video on him. Now, he can remember his wife. because he met her before the surgery was done. He knows who he is. He knows he has children. He was a concert pianist and he can play piano beautifully still, but he can't create any new memories. So every time he sees his wife, it's like he hasn't seen her in years. He wouldn't recognize his children because they've grown up and he doesn't know what they look like anymore. Even if he looks in the mirror, he's very confused as to who that is because that's not what he remembers himself to look like. And so check out this video. It's really quite sad, but also sweet at the same time, especially the way that he interacts with his wife. Now, the really cool thing, though, is that tests with patients like Clive Waring and patient HM have shown that they can still learn procedural memories. So in class, we're going to do a mirror star tracing task. I'm going to put a video of it in the YouTube playlist, so that way you can see what this looks like. But patients who have anterograde amnesia, they will have no memory of having done this difficult task, but because their muscle memory remembers it, because it's a different system and it's stored differently than the hippocampus, they can begin to do it really well, and they actually get progressively better at the task, even though they have no memory for doing it. So check that out, and in class we're going to do the mirror star tracing task. We also have people who have superior memory. So people who have what's called photographic memory is really known in the field as eidetic memory. Please check out the video about Sheldon complaining about people mischaracterizing it. So what they use is eidetic imagery. This is the ability to retain a projected mental image long enough to make it useful as a source of information. Now, we all use mental imagery, mental pictures, and visual depictions are used in memory and thinking all the time. So if I ask you, what does your house look like, or what's the layout of your bedroom, you can recall those memories and use mental imagery. We're talking about that a lot in the next chapter. But people with eidetic memory have this really, really specific and exquisite version of this. So with someone with eidetic memory, they could look at a paper or a page in a book and then later on read it in their mind. One of the tests for this is, have you ever seen like an old TV, a projection TV, and it has like the static and it looks like snow or ants, or it just looks like static on the screen? What they do is they take a still image of that and then a still image of another one, and then if you were to take those two images and project them on top of one another, you'd actually see an image. Kind of like the magic eye, but it's just like two pieces of paper overlaying each other. They can actually do this in their memory. So they look at the one picture for a couple seconds, look at the second picture for a couple seconds, and they can merge those two things together in their memory and see the image. And they can do that. That's how precise eidetic memory is. So it's not exactly what we think of. Now, when Sheldon's talking about it in this silly TV example, what he's actually talking about is eidetic imagery as well as superior autobiographical memory. So we're going to be talking about that in the next slide. There are some people who are memory champs. These are people who can remember really long strings of digits, and they use chunking like we talked about earlier. And people who remember things like meal orders, so people who are servers who've been doing it for years, they can take the orders of everyone at the big table. They can remember all their little alterations, their drinks, their appetizers, dressings, and all that good stuff. And they can do this for 5 or 6 tables and do this all night long. And they have the superior memory for what they've been trained for. But they won't have superior memory in other aspects of their life. They will just have it for this one area that they've trained within, which is pretty interesting how average people can really become quite amazing at these things. So there's a video about, I thought I had a slide on it, about a woman who has superior autobiographical information. She's an actress, and she'll kind of explain how it works in her mind, as well as there's a documentary available online if you want to look that up as well. So how to improve your memory. This is really useful throughout life, especially as students. So use elaborative processing. Be selective. Don't worry about little details. Worry about bigger concepts first. Stay organized. Consider whole versus part learning. Be aware of that serial position effect. Encode retrieval cues as much as possible. Overlearn and use spaced practice. Going back to the retrieval cues, if you're studying, try like chewing a mint or chewing gum before you study, and then do the same thing when you go and take a test. That might be a nice little retrieval cue that helps you remember information. You can also do that with like perfumes or lotions. Just don't be stinky in my class. And then also you could do make sure you're wearing similar clothing, or you're studying in the same spot Maybe, after school, come into the classroom and study instead of going somewhere else or studying at home while you're in aftercare, because then you'll have those memory cues working for you as well. You can also rely on retrieval practice, using, self-testing techniques, use mnemonic devices, extend how long you can remember things, so gradually lengthen the time between self-testing, and then mind your sleep and hunger. If you're exhausted or you're hungry, you're not going to be, at your best, so make sure you're keeping an eye on those things. All right, we are done with Chapter 7. Thank you so much.